Well, welcome everyone. This is our talk, our next talk, I should say, in our Brave New World series for Science Unwrapped. My name is Greg Podgorski. I'm Associate Dean of the College of Science and Chair of the Science Unwrapped Committee. And this year's talks have been amazing to me, not only for the quality of the talks, but we planned these a year ago, and the timeliness is eerie. And I wish it weren't so. I wish we weren't giving a talk on viruses, vaccines right in the middle of a pandemic, but we are. And I'm really proud to introduce our next speaker, and this is Dr. Thayne Sweeten. His talk tonight will be Vaccine Fears, Fact and Fiction. And again, this is right up along what we're seeing in the world today. So before I introduce Thayne in detail, I want to give some thanks and actually ask you to do some exploring. And that is, in the good old pre-pandemic days, a huge part of Science Unwrapped were our volunteer activities. We still have volunteer activities, and I really encourage you to look at our Science Unwrapped website and explore nearly a dozen video science activities that you and your family can do. And these activities have been put up by about 9 of our different volunteer groups. And so I thank the groups that have put a lot of work into this. And there's a lot of stuff that has to happen behind Science Unwrapped to make this possible. So there are many people to thank. Technical staff, and I want to give a big shout out to USU Media Production that makes these live events possible. So thanks to USU Media Production. What I want to do now is introduce our speaker, Dr. Thayne Sweeten. Thayne is a Utah native, grew up in the Salt Lake area. He made the right choice and became an Aggie for his bachelor's degree in biology. Thayne, after his bachelor's degree, went on to the University of Indiana and Purdue University School of Medicine in Indianapolis. Thayne will tell you a bit about that. After Thayne's PhD in medical neurobiology, Thayne came back to Utah, where he did a postdoc at the University of Utah, and then another postdoc here on the USU campus in the Centers for Persons with Disabilities. Thayne became a faculty member in the biology department about 12 years ago. I've known Thayne since that time, and Thayne has an extensive teaching background, but he's also kept active in research. He has been director of the Biomedical Research Lab at the Centers for Persons with Disabilities. He's had a long-standing research interest in the biology of autism spectrum disorders, and that's part of the story he'll be telling you tonight. Thayne is also the president-elect of the National Society for Biology Teachers, so that's quite a prestigious honor. So I say Thayne, again, has straddled the worlds of teaching and research, and we're really delighted to have him. One new feature that we'll be doing tonight and through the rest of our Science Unwrapped talk this spring is asking our speakers how they became a scientist. So before Thayne actually begins his talk, let me ask him a question. It may sound canned, but it's sincere. So Thayne, how did you become a scientist?
Well, thank you, Greg. As he mentioned, I started out here at Utah State. And while I was here, I had the opportunity to get involved in undergraduate research, just such a big part of our university. I worked in a lab with Reed Warren, doing autism, but really when I say worked, I took out the garbage, I scrubbed dishes, mixed a few reagents, and fell in love with research. They say, when I was younger, I watched a lot of Star Trek, and they said in that show, space is the final frontier, and that we could boldly go where no one has gone before. Well, couldn't get out to space, but I can do that with research. It's an amazing feeling and experience to design a study and find a result that no one else has seen before, to be the first to see something that could possibly make a difference in the world. So I love the opportunity to do research and amazing things that can happen from it.
That's great. Great. Thanks, Thayne. So with that, I will turn things over to Thayne for his talk, but what I encourage you in the audience to do is please submit your questions through chat I'll be monitoring those questions through Thayne's talk and taking notes. And then you're free. In fact, I encourage you to ask questions after Thayne's talk, and I will monitor those questions as well. And we'll do a question and answer session for as long as it takes with a reasonable amount of time. So please ask some questions, and we will have answers given by Thayne after his talk. So thanks very much, Thayne.
Thank you, Greg, for that introduction and for the opportunity to be here to talk about vaccine fears, fact and fiction. Just a brief overview. I want to first start talking about MMR, the measles, mumps, rubella vaccine in autism, and then talk a bit about the COVID-19 vaccine, as that has a lot of relevance to our day. So again, by way of introduction, after Utah State, I headed off to Purdue University at Indianapolis. As you can see, this is right next to the city of Indianapolis, and here's the university on this curve of the White River. There are plenty of hospitals here and a large campus, and while I was there, you may ask what I was doing. Well, I was trying to get my PhD in medical neurobiology here at what some fondly call Ooey Pooey. Well, in reality, though, what I did when I was there is I changed a lot of diapers at Ooey Pooey because I had a beautiful young family at that time, and there were plenty of diapers that needed changing. The other thing that happens as a young father, and my wife and I had to deal with, is with young kids, they get a lot of shots. When they're born, your doctor comes along, welcome to Earth, here is a vaccine. When they go to school, they got a whole list of them for them. And at this time in our lives, though, there was more controversy about vaccines because about the time we're going to school, a publication came about in The Lancet, which is one of the old journals, well respected. And it said with all these big old words that there was inflammation in the intestines of individuals with autism. And it was put together by this individual, Andrew Wakefield, who I've had opportunity to go to conferences and present the same conferences with him and meet him a few times, for better or worse. And while he was saying this, he said there's all this inflammation, immune activation in the intestines, which are important, of course, for digestion, absorption of food. Well, that created a lot of controversy because in that study, which he did while he was working here at the Royal Free Hospital in London, he said that these 12 families with their kid came forward to him in his clinic, and they said that they presented with all this inflammation in their intestines, but he said that for 8 of them, it all happened right after they got their MMR vaccine. And not only that, they developed autism symptoms. Autism is a severe disorder with communication problems, social issues, and a lot of repetitive behaviors that occur. So he said it had to do with the MMR. Now the MMR is a vaccine. We know vaccines are treatments that help prevent disease. And the way that MMR works, especially for measles, is what we do is we infect with a weakened virus for measles. The immune system can fight that off very easily. And so the next time that the wild type or the strong real virus comes along, the immune system's ready and it will fight it off. So Wakefield was proposing here with his first study that the measles from MMR vaccine is somehow getting into the intestines and causing this inflammation, which is linked with autism. He proposed this new variant of MMR-linked autism. So with that hypothesis, he wanted to give additional information to support his preliminary study. So he worked with Ullman in 2002, and they went to the intestines of individuals with autism, did some PCR assays, some special assays to look for measles virus, and they claimed they were finding a lot of it. 75 out of 91 children with autism had this virus they found in their GI tract, in their intestines, opposed to just a few
controls. So he said, look at that. This is contributing to autism. Another study shortly followed by Singh and Jensen, and what they found is that individuals with autism had higher levels of antibody. Now, antibody are proteins that help fight off infection that are made by the immune system. So they're reporting that they have higher blood levels of anti-measles antibodies. And that's compared to controls. And they're saying, well, that means that there is a connection between measles and autism. So this is what they're using to support this theory. And as you can imagine, this creates a lot of angst in the world. For me, my wife, as young parents, were like, oh my goodness, well, looks like there's all this data from good journals, some of, at least the Lancet, saying that there could be a connection between this vaccine and autism. Should we get our kids vaccinated? Well, that's a big question because measles is deadly. Mumps and rubella, these are problematic viruses. And you don't want anyone to get measles. About 300 people die each day around the world from measles. But at the same time, autism is on the rise. It used to be 1 in 5,000, 1 in 2,000. Now we're saying 1 in about 50, 54 children born in the U.S. have this severe developmental disorder. What should we do? A number of parents were faced with this dilemma, and perhaps still are. And because of that, the number of people getting vaccines started to wane in the population, to the point where measles, which used to be eradicated from the United States, has reappeared. And in the UK, they had their first death from measles infection in a long time. You can see here, 2019, we really started to increase in measles, a preventable disease. So this has created a lot of concern. Well, I was in a unique spot as a father and a researcher in the area of autism and the immune system. That's what I did. That's what I was trying to become in graduate school. So I had an opportunity to pursue these questions on my own, to look at the research, the data, and even do the research to find out if there was any connection with MMR and autism, to find out if it was fact or fiction. So let's take a look at some of the things that have been found, including some of my own work. You ever been to a birthday party? I've noticed this every time. You go to the birthday party, they pile on the candles on the cake, big old flames coming off there. And then every single time, the person whose birthday it is, they walk up there, take a deep breath, and they just blow it all out. And then they get a year older every single time. I notice this. Light the candle, you blow them out, you get a year older. You can try and say, don't do it, but they'll do it. There's a connection there, right? But is it real? Is that true? Every time you blow out the candles, you get older? Now, what Wakefield was claiming is that when the kids get the vaccine, then they got autism. He said that there's a correlation there. But just like with candles, blowing them out doesn't make you older. If there is a correlation, it doesn't mean that it causes something to occur just because they happen at the same time. In fact, one would expect that people would get autism about the same time they get their MMR because they correlate in time. The same time that people get their MMR vaccine is often when they are diagnosed with autism symptoms. So we would expect that correlation. Now, as we look at Wakefield's original study, if you want to call it a study, because it was weak in a lot of ways. It didn't have a control group, meaning a group to compare that did not receive the MMR and become autistic. It had very low numbers of subjects, just 12 people that he observed and figured that were his subjects. It was data based on recall. Now, if I were to ask you, where did you go on your family vacation 3 years ago? Oh, sometimes that's a little hard to remember. I hope you had a good vacation, but not always easy to remember these things. So that's not a great way to get data, which is what they were relying on. So this first preliminary study really was just an observation, and it wasn't very strong at all. Now, something we need to review here to set up this next part is the central dogma of molecular biology. Remember how we said that he found with Ullmann that there was measles virus in the GI tract? Well, we've got to understand a little bit about measles virus. It's an RNA virus like COVID. And when we look at the central dogma of molecular biology, we say we go from DNA to RNA, and then from RNA we can make protein. Now, there is an enzyme, reverse transcriptase, that does this RNA to DNA in reverse. We call that reverse transcription. So measles virus is an RNA virus. The problem is RNA is very hard to detect and to amplify. It breaks down quickly. We can't do our PCR reaction that we need to on RNA. So in order to detect the virus, we got to convert the RNA back to DNA, which is more stable, and we can make multiple copies of that DNA so that we can visualize it eventually. And this is called reverse transcriptase PCR, quantitative PCR. We use it even to do the COVID tests now. It's a very popular technique. Well, that's what Wakefield and Ullmann used in order to detect measles virus in their samples. Here's the problem, though. This guy by the name of Buston, he was involved in all the lawsuits that came up and dilemmas and problems with Wakefield's study. So they went and investigated the way that they did the study using the PCR. What they found is that they were detecting measles virus in the autism samples even when they didn't do reverse transcription, when they didn't take RNA back to DNA. Which simply said, it's impossible. You cannot detect measles virus without reverse transcription. The only way to explain that phenomenon is if there was contamination of DNA from other PCR reactions in those samples. 3 other studies cannot replicate what Wakefield is saying. His technique is busted by Buston. It just did not work. So that study was a bust. And what about the Singh and Jensen study that found the high measles antibody levels in autism? I had the opportunity to try and replicate this study. A lot of details here, but basically we looked at measles as well as mumps, rubella, diphtheria. We had multiple control groups, positive controls, regressive autism, classic autism, a number of different things here. Simply put, we could not replicate it. We did not see any difference in antibody levels to measles between the autism cases and controls. But what we did find was quite interesting. We did find something within the data that showed an age relationship. And the age was very important, and this has been seen by other researchers. What we saw is that the younger individual was, the higher their levels to measles antibody were. And this is most likely because they get the MMR vaccine right before they go into school at about 5. And then over time, the antibody levels start to dissipate. This is why we get boosters sometimes for vaccines. And so what this brought up was the fact that, wait, we're seeing differences in age. So we asked Singh and Jensen, well, what was the age of your cases versus their controls? And it turns out their autism kids were about in this area, and their controls were, in fact, older. And so you would expect that the autism individuals would have higher levels of antibody than their controls. It was an age finding that they were reporting. They didn't report it in their initial data. They didn't even report the age. So it wasn't a well-done study, and it didn't hold out. It couldn't be replicated, and it had errors. So since then, not only our group and other groups, but 20 studies, more than 20 studies even, from various countries throughout the world involving thousands of children, have not been able to find any connection between the MMR vaccine and autism. And these are all different independent groups in different places. Here's one example of a study from the UK, very large data set that they used. We can see that the MMR rates are staying the same where the autism goes up. It just doesn't match up. So based on all of this data and evidence, even that which I've seen and done myself, I answered for myself some of the questions I had about the safety of MMR and autism. That based on the preponderance of evidence, there is no link. In fact, Andrew Wakefield lost his medical license. The paper was retracted, and it was a big scam that was found out through the medical community. So going forward, I was all right. Okay, the MMR is safe. It's not going to cause autism for my kids or anyone else's. I was not afraid of that vaccine anymore, besides the sharp needle, right? But what about coronavirus? And this is a new thing that we need to look at. It's come on pretty quick. Is there a reason to be afraid of this? Before we get into that, I'd like you to note something about this virus. Look at these spikes on the virus. These spikes are what help it get into a cell and infect the cell. And they look like crowns. So it got its name coronavirus because of these crown-like spikes that are found on it. So, okay, well, there are things to fear. One of them is this is a deadly virus. And this is looking at world data as of today, 96 million cases, over that, throughout the world, and over 2 million deaths, which is about 2/3 the population of Utah has died to date from this virus, which causes other pathology as well, other problems and issues with the lungs and other organs. Yet there are a lot of people who are a little hesitant about this new vaccine that's coming out. This is a study done by the KFF group here from COVID, and they, KFF COVID-19 Vaccine Monitoring Group. What they found is about 1/4 or 25% of the individuals that they surveyed were a little hesitant about this vaccine. And they asked them also why, this Kaiser Permanente group, they asked them why, and they said, well, we're worried about side effects. Something nasty might happen, or the government, right? We got politics that was thrown into this whole deal as it was an election year. Too new. It just hasn't been around long enough. I don't know the safety profile over time. People are concerned about that. They say, well, COVID's not that bad anyway. They don't trust vaccines, perhaps thanks to Andrew Wakefield and others. They don't trust the healthcare system, or they're worried that they may get COVID-19 from vaccines, which is totally impossible. And I'm grateful for the healthcare system for all the work that people have done to help protect us from this virus. And they also worry about saying, well, I'm not at risk of getting sick, which if you interact with people, there is a risk for getting sick with COVID. So these are a lot of the concerns. They basically are worries about side effects and lack of trust in the institutions that promote and bring about the vaccines. Well, here we're looking at the 2 approved vaccines that are here in the United States at this point. We have the Pfizer, BioNTech, and then the Moderna that are currently out there. These are messenger RNA-based vaccines, which is a new type of vaccine. Just a little bit about that type of vaccine. It is messenger RNA, so this is what you use to make proteins. They package them in a membrane. It's a lipid nanoparticle is what it's called, a very small particle with a membrane around it that's very similar to a cell membrane. So when this lipid nanoparticle is injected, it will bind to cells and fuse with them with the shared membrane, and then the messenger RNA goes into the machinery of the cell where it makes copies of, guess which protein? That spike protein that looks like the crown. And that spike protein then is presented on the surface of the cell, and the immune system can see it there and mount an immune response against that coronavirus spike, which will protect us from future infection against the real virus. So that's what an RNA vaccine looks like. Now, in order to get a vaccine approved, it has to go through a lot of different phase trials, all of them looking at safety, efficacy, and dosing even. And as you get into these phase 3, they can be very large trials. The one for Pfizer was over 30,000 individuals. After the trials, the FDA, the Federal Drug Administration, looks at it, all the experts that are employed there. And then if it's approved, then there's post-review surveillance where we can constantly get information about anybody who's having an adverse event because of the vaccine. So typically, it takes 10 years to make a vaccine. You don't need to worry about all the points here, but this time it only took us 1 year for Pfizer to make this vaccine. In fact, less than a year. It's quite amazing. They had this messenger RNA vaccine technology just getting ready to go right as this pandemic came along. And it's much quicker than our traditional techniques. And so, wow, here they are with less than a year, and we now think we have a vaccine. Now, some might say, well, that's a little scary though, you know, because that's so quick. So that is a concern. So this is looking at, does this vaccine work? And you can see they had a lot of participants that they gave the vaccine to. And of those that received the vaccine, they split them like half and half, only 8 got COVID infection, and it wasn't a real bad case. Of those that got placebo, it was like salt water instead of the vaccine, 162 became infected with COVID-19. What does that mean? That means the vaccine works 95% of the time, which is very good for a vaccine. Much better than most of the flu vaccines that are out there. What about safety? This is what they reported. Pain, maybe that has something to do with needles, and that's more common in the vaccine group, and perhaps a little fatigue or headache, but not much different than the placebo group. So the main safety problem was pain. Since that study has come out, we can look at the Morbidity and Mortality Weekly Report and see what has happened in the general population. And one of the reports that's coming out is the risk of anaphylaxis. This is a severe, as it says here, life-threatening allergic reaction that can affect breathing and blood pressure, and it can occur after vaccination. So this is a serious concern. They found in their first dosing of their putting this out, they found 21 cases. And you might say, well, is that unusual? No. In fact, for most vaccines, even other drugs and such, you see some allergic reactions. And so we're looking at about 11 cases per million doses. I think that the reason this is a little higher than some of the other vaccines is the fact that this has been given to so many people, including older individuals who already have a lot of allergies and histories of allergies, opposed to just giving them to young kids. So of these cases of anaphylaxis, 71% occurred within 15 minutes, and all of them that I've seen in the literature, they've been able to treat them. The people have been fine, and they go on without any serious consequences. But they are a serious concern. So what the FDA has recommended is check people for allergic reactions. If you've had severe allergic reactions, especially to vaccines, then there's risk that you might have one against the COVID vaccine. And then they also will watch you for at least 15 minutes, and if there are any problems, immediately treat with the treatment here, which is epinephrine, which will counter the allergic response. So that is the primary concern with this vaccine. Now in science, especially in medical research, one has to weigh the risks and the benefits. We know with this vaccine that there are some risks of pain and perhaps anaphylaxis, which we can monitor and treat. The benefits, on the other hand, are protection, 95% protection against a severe disease that's deadly, that is crippling our economy, causing a lot of psychological concern as we're isolated and we can't get to school as normal, to work as normal, to our regular routines. And that has a big weight on society. And we as individuals have to weigh the benefits versus the risks. But this And it's an important decision that we make. One of the other benefits of the vaccine is as individuals get the vaccine, it will protect not only them, but those around them. Because the more and more people are vaccinated, the less and less the virus can penetrate into society. If we get up to high enough amounts, we have what's called herd immunity, and those who are vaccinated are protecting those who cannot get vaccinated, perhaps because they have severe allergic responses or other immune issues. So that is one of the benefits of vaccinating. Now for me, being a researcher and seeing the process, reading these studies and knowing what it's like to be on this end of the table, I have trust and faith in these researchers. They have families. They have a desire to do their very best and make a good product that will serve humanity. And I believe that is what they have done here. These are good people who we can trust, who have been watched by many others, scrutinized, tested, been through multiple phase trials, and continue to have their product tested, and it's looking effective and beneficial. With that, I'd like to open it up to some questions and discussion, and maybe Greg will help monitor some of that. Be pleased to talk here.
Okay, thanks very much, Thayne. Really appreciate your talk. And for members of the audience, we've got a few questions that have come in, but there's plenty of room for additional questions. I'm going to take these pretty much in the order in which they've come in so far. First question, Thayne, I'll paraphrase a bit, and that is that what was it that allowed the Pfizer and Moderna vaccines to be developed so quickly?
So typically we'll make a vaccine like the flu vaccine is grown in eggs, and that takes a long process. With the messenger mRNA or RNA vaccines, they can create the messenger RNA in a lab with chemical processes very rapidly. And so they can design them quickly. They know exactly what they need to design them against, which is the corona protein, and then they're just very easy to manufacture. They don't have all the components of the egg in there for allergies and added things, so they're very clean vaccines. So they don't have to worry about all that and clean them all up. You get a pure product quickly, it's laser designed, and it can be mass produced very easily.
Okay, thank you. Another question that came in is related, and that is concerns for the speed of vaccine development, the fact that many people are worried. Things have gone too fast. How do you respond?
Well, I think it's a fair concern. I mean, typically we say the test of time determines whether something is safe. So there's a concern that, well, what in the long run, that there could be a long-term issue here. And that is a possibility. Now, having said that, I am much more concerned about the long-term possibility of getting this infection and having it scar my lungs or damage my sense of smell or even be deadly. And the physiology of this vaccine does not present great risks biologically. I mean, we're not looking at something that just from thinking about, looking at it and seeing how it works, that one would say, well, I can see how that's really going to be a lot of damage in the long run. So I'm comfortable, but there is very minor possibility that we might find out more about it in the future.
Yeah, there's always fear of the unknown.
Yeah.
Yeah. You don't know what you don't know. A question that I apologize if I get this one wrong because I was a bad student. I was looking at technical things in the recording studio. And if I got this right, it was about Wakefield's initial study where he thought that he was looking at kids with intestinal inflammation. How did he know that these kids were suffering intestinal inflammation?
Well, that was his job. He's a gastroenterologist. And so he did the endoscopies and scoping and all that kind of stuff. Kind of an irony, I think the other reason he knew is that many of them were kind of invited to his clinic and were part of a lawsuit that he was trying to drum up. So it looked as if there was a little bit of foul play that occurred in that whole process. But yeah, that was his job. He looked into the intestines and did research.
Okay, thank you. I'm looking at another one I've got written in my scroll, but let's go to the questions that are legible, because they've come in through the question and answer feature. So a question from one audience member was that I do all kinds of things to boost my immune system. Healthy foods, exercise, vitamins, special supplements. Why do I need vaccines?
Well, okay, one of the first thoughts that comes to me there, some of the people that, one of the problems with COVID is it's actually our immune system that causes the death. Our immune system overreacts and creates all that pneumonia and inflammation. A strong immune system is a great idea. Getting good sleep, taking good care of your health. But these viruses are more powerful than that, really. They can overcome a healthy immune system. Though it's a great idea to keep a healthy immune system, it's just not enough at the face of the weapons that these viruses produce.
Okay, thank you. Another question was, shouldn't I worry about putting foreign things in my body? Isn't it better to become immune naturally?
Well, I guess I could go a lot of directions with that. I mean, we eat all the time, right? I mean, we eat things, and who knows where some of that stuff's been. And would it be better to become immune naturally? Well, if we look at this from the idea of a vaccine, basically a vaccine is taking a part of the virus and putting it into our body, but that part of us cannot cause disease. If we want to go naturally and we get the real virus, that real virus is designed to spread in millions and millions of copies, go to different areas of our body, attack them, destroy cells, cause pathology or problems. If we want to go that route, there's a lot of risk. Yeah, we'll get immunity, but it could kill us, you know, and we could spread it to someone else and they could die. So I'd rather have just a little piece of that virus infecting me than have the whole thing coming with its anger, right? And that little protein, it's just a protein. I mean, our body's made of proteins. So it is natural. We don't look at it that way. So I think it's better to go with the vaccine than have a wild type infection.
Okay. Let's see, another question. Let me scroll down to this. Do you know the anaphylaxis rate for seasonal flu vaccine?
I do not. Just the ones that I showed there for MMR and DPT, I don't know what it is for.
Okay. So another question is, will getting the current COVID vaccine and the current influenza vaccine make it harder for our bodies to resist future novel coronavirus and influenza viruses that may be much worse than the current strains?
No, in fact, it's just the opposite. The older we get, the more we are exposed to viruses and we create antibody. In fact, there's been times with some of the nasty, like swine flu, bird flu, where there have been the older populations that have done better because they've previously been exposed to similar viruses, and therefore they had antibody. So it's just the opposite. Getting these vaccines will actually help in the future because the antibodies can often cross-react to similar type of viruses that come and therefore give us a better immune response in the long run.
Okay, great. Let's see. Is there a risk similar to the flu vaccine for those with Guillain-Barré syndrome?
Do not know, and I don't know that that's well understood at this point.
Okay.
Just not a lot of data.
A question of, have you gotten a vaccine? And if so, did you have side effects?
Well, appreciate that question. No, I have not got it because I haven't been offered it. I am excited to get it. I want to get back to normal life. I did have a friend, I've heard of people who've got it, and a few of them said, yeah, it made me a little weary, a little bit sore. So there were some side effects. But no, I'm waiting in line, but I'm glad to have those who are 70 and older get in the line first because they really need it. They're much more at risk.
Okay, thank you, Thayne. Let's see, I'm scrolling through the questions here. How long do the crowns that the RNA puts on the outside of the cell last?
So the RNA itself will last about a couple hours inside the cell before it will be degraded. And so they're not going to be expressed much longer than that. Those proteins might last a little longer out there, but it really is a transient response without a lot of longevity. But it's enough to trigger the immune response.
Okay. Thank you. Can you go into more depth about the chemistry and the reactions behind the vaccine and the virus? I think the simple answer is going to be yes.
Yes. The chemistry and the reactions between the vaccine and the virus. So the vaccine codes for the spike protein of the virus. So when the messenger RNA goes into the cell, it will actually produce a little piece of the virus and present that little piece on the surface of the cell. Then the immune system comes and recognizes, oh, that's the bad guy. And it will start to generate an immune response against that coronavirus spike. And then the next time that virus comes along, the immune system's ready to go, it's strong, it's prepared, it's seen it, and it will come in and it will win that fight quickly. And we won't even know we got sick because of that exposure. So I hope that answers the question. I wasn't exactly sure the angle they were going, but I think that's the mechanism.
I think it's a little more detailed, but I think that hopefully that does it.
Okay.
Why do most allergic reactions happen so quickly after the vaccine is given?
Well, there are two parts of the immune system. One is the innate and one is the adaptive. And so we have rapid responders in our immune system that come quickly, look at things and attack. For this vaccine, RNA, one of the reasons this vaccine is so effective is it uses RNA. We might have heard of an adjuvant. Adjuvants help vaccines work because some things you put in your body, the immune system doesn't even care, doesn't even respond. RNA actually triggers immune responses on its own. If we have foreign RNA coming into our body, it looks like a virus. And so the body will start attacking that. We have receptors for it. It'll spit out chemicals called cytokines, and those are what help trigger some of these allergies and some of the anaphylaxis that occurs. So it's our innate, our early immune responses that are there to just jump on something quickly to buy time for the later part of the immune system, which is more powerful, that are making these early responses that are often the anaphylaxis.
Okay. Let me look down the list. I want to make sure I'm not missing things as I'm scrolling through. Let me see if I can paraphrase this. So the question is, what would happen to a drug company that would have been found to have cut corners? Or are they motivated to do good science?
Well, I believe they're motivated to do good science. There's been a history from Salk and others. There have been a history of, I'd say, noble scientists who's even donated their work to the world for the polio vaccine and others. These are times when researchers and these vaccine companies rise to the occasion in a very good way. They're on the world stage. They're highly invested in doing this right. They know that it really matters. And I think they have done that. I've been very impressed with their speed, their accuracy, the quality of the product. And how do you know that they haven't cut corners? Well, everything has been out in the open. People can see and look at what they've done, the people that are part of these studies. The FDA has been watching them very well. You know, there are other people watching. And so I think the proof is in the pudding. How is their product? How well does it work? And does it cause side effects? And so far, it's looking pretty good, and hopefully it will stay that way. Right?
Yeah, I certainly hope that as well. Look at some other pictures over here, or questions, I should say. So what's known about the longevity of protection provided by the Pfizer and Moderna vaccines?
Well, they've only been around for months, and so what's really known is they're good for months. You know? One would expect, though, that they are going to have, it's going to be longer than months, because most vaccines do that, but they vary. Some of them give you lifelong immunity. Some of them, like tetanus, you need a booster every 10 years. Some of them, especially if the virus mutates a lot, we might have to get revaccinated. But I think that it's going to be, at least a year, but we'll find out. No one really knows for sure at this point.
Yeah. And let me see. Is there any significant difference between the two types of vaccines that have been approved in the U.S.?
The Moderna and the Pfizer, the main difference, they're basically the same mechanism. They're nanoparticles, they're messenger RNA. The main difference is that the Moderna, you can put in a freezer and it will survive in a freezer. With the Pfizer vaccine, it needs to go into dry ice. It needs to be super cold, which is kind of problematic, especially if you're going to take it somewhere where you don't have a lot of access to solo freezers, super ultra cold freezers. So I think the main issue is just the longevity. RNA doesn't survive well. It needs to be kept cold, and these little nanoparticles probably a little finicky as well. So the main difference is the storage conditions of the two. But otherwise, they look fairly similar with how they work.
Yeah, thanks, Thayne. So longer question here. I need to work my way through it. So wouldn't you say the most negative effects on the economy as well as psychological trauma are because everyone is overreacting to a disease that has only a 2% death rate? And if everyone lived their lives normally, the economy would be better, the disease would go through the population with only 2% of people dying, and most of those being older people who already have weaker immune systems would likely die from flu or similar diseases.
Well, I guess, that depends on how much value you put on life. I love my mom. I don't want to see her go. And those individuals have more like a 15% chance of dying, and can be a very severe infection. Do I think that we're overreacting? Depends on how much you value life.
Okay. Well, let's see some other questions here. Do you think that there will be a COVID vaccine developed for children?
Right now, the Pfizer vaccine goes down to 16. I do believe that they will continue to bump the age down and do clinical trials in younger ages. Having said that, if enough adults go and get vaccinated and we get good herd immunity, that could protect those young kids, and they might not even have to have it. But I think in the long run, they're more likely that we're going to see that. We're going to see children in clinical trials for these.
Okay.
Yeah.
Does the coronavirus possibly affect our DNA?
No.
Okay.
It has no way of inserting into the DNA. It's RNA, and it won't do that, and it will be eaten up by RNases, which are in the cell fairly quickly, within a couple hours. So no, it will not interfere with our DNA.
Okay. And I want to make sure I haven't missed earlier questions. So do you know what ingredient in the COVID vaccine people are allergic to?
No, there's not a lot to the vaccine. They could be allergic to a number of different things that the immune system's reacting to. Could be that messenger RNA, could be part of the lipid around it, maybe some added ingredient, but it's often unknown what people are responding to. Having said that, with some vaccines, people have been allergic to the egg proteins that were when they make them in eggs. So this is a cleaner vaccine. No, we don't know. It could be a variety of different things that could trigger that.
Thank you. Let's see, will both the current vaccines evolve to the new strain of COVID that has been found?
So far, the studies that I've seen, and they're just preliminary, are hopeful that the current vaccines are actually pretty good against the evolving strains. The thing about it is these vaccines are probably generating antibodies that can attack from different parts, from different sides. So even one mutation is not going to be enough to overcome all the different antibodies. So I would be surprised if it's just a single mutation is enough to throw off these vaccines. But it is possible, that enough mutations occur. The problem for the virus, though, is if it has too many mutations of that spike protein, then it can no longer bind to a cell. So we've attacked the perfect protein. Too many mutations, it won't infect us anymore. So hopefully that won't occur. The vaccines will continue to work well as long as we need them to.
Yeah, that's certainly a thing to hope for. Let's see, from your description, it seems the COVID vaccine makes regular cells imitate the form of coronavirus, and that inspires the start of the immune reaction. So we can paraphrase. So I guess the vaccine actually transform some standard cells to imitate the coronavirus?
Yeah, that is a way what it does in a very minor way. But the way that all cells, or especially our immune cells, work is very similar. They'll attack a virus, gobble it up, so to speak, and then present a protein from that virus to the immune system. So all we're doing is custom delivering that protein right into the cell. Yeah, this is the one we want you to present. Now, you don't have to go through the whole process of fighting off that virus and dealing with it. We'll just give you that little protein. Here you go, present it, and then the immune system will see it. Very clean process that's mimicking what the immune system would do anyway.
Okay, great thing. Thank you. And as a part two to the question, actually, same one we just asked, but then why doesn't just getting the virus in the first place do the same thing as a vaccine?
Well, it should technically, and perhaps even better than the vaccine. We just don't know enough for sure because we're so new at this. But technically, from my experience, when someone gets a wild type infection, they actually will have better immunity than the vaccine.
Okay. Why have some people who have gotten the vaccine go on to get COVID-19?
Well, that happens with most vaccines, believe it or not. And there could be a lot of different reasons for that. One of the reasons is we all have different genetics, especially for our immune system. And some individuals don't handle certain viruses very well, and they even don't respond to them. So they're not perfect, and we're all different. There's enough variability in biology. Those who do often go ahead and get the second infection, what I've seen, if they do that it's not severe, they do have some immunity against it. Just because we have immunity to something doesn't mean that it cannot reinfect us. It can attack again. It's just typically we're going to fight it off much more quickly so that we don't even notice that we had it or see symptoms. But sometimes you can get that second infection they've seen, but it's usually not as severe.
Okay. Oh, let's see. I'm looking. I got some related questions here. Can you be a carrier of COVID after being vaccinated?
Yes. Especially if you're getting one vaccine and then you're waiting for your second, there's only a 50% reduction in between there. You can still get the virus. And even after you're vaccinated, you could have the virus start attacking you. And before you fight it off, you could be a carrier for a brief period of time. So there is that risk still. The benefit is if enough people get vaccinated, the virus is having a hard time infecting people, it's having a hard time staying there long, and it has a much more difficult time jumping from person to person. It cannot penetrate through populations well because we're getting rid of it so quickly, and too many people have strength and immunity against it. So yeah, it is still a possibility, and that's why even after you're vaccinated, they're asking you, continue to wear a mask, continue to social distance. We need to basically pound this virus back. And the vaccine is going to be a huge tool in doing that. But until it's pushed back to minimal amounts within the community, we still need to have care and masks and distancing.
Okay. Let's see. So a lot of related questions. So will we need to essentially get a yearly vaccine or yearly vaccination similar to what you have for influenza in fighting off COVID?
Well, that's yet to be determined, but my intuition there is no. There's something unique about influenza. Influenza is a new strain every single year, and influenza mutates much quicker than the coronavirus does. So I do not think so. Though we might have some variants that come along and say, well, here's another vaccine. In fact, with the influenza vaccine, there are actually 3 different variants, sometimes 4, that they put into that single vaccine to try and cover the bases of what could be going on. But I do not think that that's going to be the case here. And if it is, it's not going to be as quick like every year. This is going to be more like some of the more stable viruses that we're dealing with. And,
Something to certainly hope for.
yeah.
I'm looking for other questions. And again, for members of the audience, I'm not asking every question that's been asked. And what I'm trying to do is to look for groups of similar questions. So if I don't get to your question, my apologies, but I hope a similar question has been answered. A concern I've heard is that the COVID vaccine could possibly cause infertility. Is this a valid concern?
I have not heard of that. And the vaccine, you mean?
The vaccine.
I would have to say that there's been nothing in the literature that I've seen about that or in any of the clinical trials. So I would assume that that is more rumor than fact.
Okay. So comparing polio vaccine to COVID vaccine, how effective is the polio vaccine compared to the COVID vaccine?
Well, face-to-face, the battle of the vaccines. Obviously, we know that polio vaccine is very effective because we don't see it anymore. 95% though is very effective as well as a vaccine. So I think I don't know the percentages for the polio, but I would think that these are both grade A vaccines. They're very well designed, strong vaccines. They're probably similar in their efficacy.
Okay. So lots of people are concerned about long-term issues. If there are long-term issues, what does it mean for the future of vaccine development?
Well, I think the biggest long-term issue that vaccine development deals with are, to be blunt, lawyers who take advantage of suing and trying to kill the whole vaccine industry. Are there some side effects? Yes. Could we possibly see some long-term ones? I think most of those, again, I'm just being blunt here, often they're drummed up by lawyers looking for a lawsuit, and they're going to take something, well, maybe this could have been connected with it. They don't know for sure. They bring it to the courts to try and get some money. That's basically what we see with a lot of these long-term. I don't want to minimize some legitimate issues that have come up, but I know that there's a lot of illegitimate ones that do. And so I think that the biggest fear that vaccines have to deal with are those kind of litigation issues that are not necessarily based on real good science, just some correlations that bring up emotions.
Okay. We keep going down the list. How do we know we can trust you?
You don't.
A scientist,
you know,
okay?
I think that that's why you need to go and read these studies yourself, and you need to get educated yourself. That's the thing. That's what we're about as a university. And how do you know who to trust? I think that the other thing besides that is, well, you can trust certain people who have spent their lives trying to do good and who have been honestly trying to research and such. So you get to know somebody, know their reputation. You know, so you can ask people that know me, you know, whether I go around lying or not, and the kind of character I have. But you need to find out for yourself in terms of, can you read these studies? Can you figure some of this stuff out? That's what I did, right? I was wondering about this, so I had that opportunity to jump on myself. We can't always do that, and we have to learn what's a trusted source. But people over time will reveal themselves and who they are. I think Wakefield has done that very clearly. Over time, it has been found out what his character is. And we know now, when I hear him speak, I'm very weary of what he has to say because he's built a reputation. And scientists have those reputations as well. Institutions have those reputations. Journals have those reputations. What's their track record? Can you trust them? And that takes time to learn and figure out. But hopefully you do that. Hopefully you will study and learn and figure things out on your own, because you'll be faced with a lot of questions and challenges through your life, and you need to be able to find your own answers.
Okay. And I think we'll just take a few more, and then we'll call it a night. I'm just looking at a few of the final questions. So how long do you think it will take for things to return to what we call normal? If people are getting vaccinated, what's your prediction on this?
Well, I know that a number of predictions have been this summer. I think that a lot of that is dependent upon how quickly we vaccinate, how many people vaccinate. You know, if there is a lot of resistance to this and like, I don't want to do it, well, then we're going to be dealing with it for a lot longer, and more people will suffer. If we are getting a lot of these vaccines out and people are open to taking them, I'm hopeful that this summer we can be to a spot where there's minimal amount of this, and it might take longer than that to get completely rid of it and all if we do. But I'm hoping this summer will be a turning point.
Yes, sooner certainly be better
Yeah.
than later.
Yeah, it would be nice.
I'm going to stroll down through here. We have a lot of questions. I really appreciate that so many people have been asking questions. Why are people telling pregnant and breastfeeding mothers not to get vaccinated?
Well, most medications that are new, the studies that they do are not going to be on pregnant and breastfeeding mothers. That's a vulnerable population where we don't want to start doing experiments on them right away. So these studies, I'm sure they excluded them from the study. So we just haven't done the research to make sure that it's safe for them.
Okay. And again, bear with me. I apologize for having to look carefully at the questions rather than having these all, right ready for me. Let's see. Are there people looking to make a different medicine to fight COVID?
Yes, there are a number of different options out there, different medicines and new and old medicines alike that are being tested. And some of them seem to have some preliminary effect. And so that is another option that hopefully we'll have going forward, is not just vaccines, but treatments. Ultimately, vaccines seem to be more effective and longer lasting than medicines that deal with it after the fact.
We'll take just one more. And let's see. Boy, there are a lot of questions, a lot of good questions here. So why don't we mask up and socially distance from one another for the flu if it mutates every year?
Well, one of the reasons is that we do have a vaccine for the flu. The flu is not nearly as deadly or contagious as this vaccine, and this is a novel, or the virus. This is a novel virus. I mean, if you look at the number of deaths, the amount of problems that this is occurring, it's much worse than what the flu does. And I'm not minimizing. There are people who die from the flu, but we do have a vaccine. People often have immunity because they've had a lifetime of being exposed. So the risks here with this virus are much greater than the flu virus. So that would be why.
Okay. Thanks, Thayne. I think what we're going to have to do is wrap things up here, and I really appreciate all the questions that have come in. I want to thank you again, Thayne, for a great and a really important talk. Okay.
Well, appreciate it. Thank you for having me.
No, you're very welcome, Thayne. It was a privilege. And I want to tell the audience that our Science Unwrapped series continues. So next month, we'll have Dr. Ryan Jackson of the USU Department of Chemistry and Biochemistry speaking about something that's not directly COVID related, but I think something you'll find really interesting, and that is genetic engineering. So the perils and promise of genetic engineering. So that will be our next talk, and I hope to see everybody virtually next time. So thanks very much. Good night.